Do you have a child with autism and you're considering the use of CBD in treatment? If so, watch this video. Hello everyone and welcome to the channel where we endeavor to educate, equip, and encourage anybody raising a child with a special health care need. My name is Dr. Nate Noble. I'm a developmental behavioral pediatrician and clinical geneticist. And I'm making these videos because there's 19 million children in America who are on wait lists just like mine to be evaluated. And I'm making these videos to help you skip the line. If there's anything of value in these videos, please like and subscribe so that we can get this information in the hands of more people. In today's video, we're talking about CBD. The outline for our time today goes just like this. We're going to talk about the history of CBD, the mechanism, the evidence, the benefits, and the dosing. This video will be time-stamped so you can skip around. Let's get started. The history of CBD is very simple. It's been around for 5,000 years with its first documented use in China. It has medicinal uses, it has spiritual uses, it has recreational uses. And you'd have to live in a hole to not acknowledge the fact that CBD is in everything now. It's in your creams and in your clothes and in your hair care products. You can't go anywhere without seeing CBD. CBD represents the fastest growing subsection of the healthcare industry, representing nearly $22 billion a year. In the late 80s, an Israeli chemist named Raphael McCullum was able to deduce the molecular structure of CBD and THC, which then led to the discovery of an internal system with very similar molecular properties called the endocannabinoid system, which we're going to talk about next in mechanism. The mechanism of CBD can best be understood by first understanding the endocannabinoid system. As I mentioned earlier, we didn't even know this system existed until we were able to realize that there were chemical structures within the human body that were very similar to CBD and THC. And those two substances are anandamide, which we're going to abbreviate as AEA, and 2-arachidonoglycerol, which we're going to abbreviate as 2-AG. These two substances have a very similar molecular property to both CBD and THC, and these two substances are agonists in the endocannabinoid system. The endocannabinoid system has been shown to help with the regulation of multiple systems within the body that affect mood and sleep and endocrine function and immunologic function. The endocannabinoid system is a big deal. And AEA and 2-AG are the agonists of that system. So think about it like the gas pedal. It's the on switch, it's the light switch, it's the plug-in. It sends the message to activate the endocannabinoid system to push neurotransmitters through from one neuron to the next to go about their business in regulating the multiple systems that are contingent upon its functioning. So how it works is AEA and 2-AG bind to the receptors that are involved in the endocannabinoid system, which are termed CB1 and CB2. And then what happens is once the receptors are activated, the products are pushed from one neuron through the synaptic cleft into the second neuron, and the system is activated and the downstream regulation occurs. And then once the receptors have been activated, the body proceeds to recycle these two agonists by breaking them down into their subsequent parts and using them for other systems that may require their services. Now, how does CBD fit into this? Well, how does CBD matter in the endocannabinoid system? Well, you first have to understand that research has demonstrated that there is a deficiency or downregulation of both AEA and 2-AG in individuals with an autism spectrum disorder, which means that the endocannabinoid system is not as activated as it potentially should be, and the downregulation of products are hindered. So mood and sleep and cognition, these things are negatively affected. So how CBD works is it inhibits the recycling of these two agonists. CBD works right here. CBD says no thank you. You did a good job, I appreciate it. We're not going to break you down into the sum of your parts. We're going to ask you to go right back out on the work floor and continue to put in another 8-hour workday for us, because we need to continue to downregulate these transmitters so that we can help the body function appropriately. But it's a gentle process, okay? It does this without being psychoactive, right? There's no buzz, there's no high, there's nothing like that that's occurring when you use CBD products. It's just inhibiting the reuptake gently because the body of an individual who has an autism spectrum disorder has been shown to have less of these substances available. So we're going to inhibit the breakdown and get the most out of them during the workday by inhibiting reuptake. Make sense? Now let's talk about how THC works. Now THC is different than CBD. It has a different impact on the endocannabinoid system, but make no mistake, they both impact the system. One of which is not psychoactive, okay, has not been implicated in increasing your risk of psychosis. The other, THC, has been. THC, for the purposes of this demonstration, is going to be demonstrated by circles. THC works differently on the endocannabinoid system, not by inhibiting reuptake of the agonists, but by competing with them, okay? So let me show you this. So the THC molecule also binds to the receptors, okay? But it does so in an aggressive and terrifying way. Okay, so think about the difference between like WWF. Okay, so if you're a child of the 80s, like Macho Man Randy Savage and like The Chair and like the whole thing, a lot of show, maybe not quite as much wrestle, but it was still fantastic. Okay, that's how the endocannabinoid system works. That's how AEA and 2AG work. They kind of do their job and they go through the motions and everyone's happy and the crowd's pleased and it's fantastic. But then imagine that instead of a WWF fighter getting into the ring, an MMA fighter gets into the ring. And I don't know any of these people's names, but I just know they're terrifying, okay? Terrifying. No offense to you if you're that, but okay. So they get into the ring and they're not messing around. I'm not going through the motions. I'm gonna grab you receptors, CB1 and CB2. I'm gonna grab you, I'm gonna put your arm in an arm bar, and I'm gonna choke you out in front of the home crowd until you tap out or pass out. So what THC does is it activates, okay, in a competitive fashion, these receptors to such an extent that nobody else can get at them. It's like choking out the receptors. So much so that AEA and 2AG are like, hey man, what are we supposed to do? Like, do I have a chair? What do you want me to do? Send some autographs? Like, what's my point here? Because THC is choking out the receptors. And when you do that, you begin to aggressively down-regulate the endocannabinoid system. And what's the product of that? I'm gonna abbreviate it. Dopamine. So THC is aggressively activating the receptors, so much so that the natural occurring agonists can't even get the job done because there's so much THC strangling the receptors, and so much product, so much transmission, so much activation has been pushed through, and so much dopamine is produced that eventually what happens? You know what happens. People who are habitual users of THC-containing products with super high ratios of THC, which is not what we're talking about. Okay, today we're talking about substances with super high CBD components that are non-psychoactive, but individuals who are maybe using THC for recreational purposes and they're using it habitually, eventually they burn this system to the ground and they predispose themselves to things like paranoia or psychosis. And it makes sense, right? You're continually stomping on the gas, revving the endocannabinoid system up to 8,000 RPMs. Eventually your brain's gonna get sick of it because your body is not meant to deal with that much of a dopamine rush continually. Eventually you ride a roller coaster for the 1,000th time in a row, you're not gonna have that dopamine hit anymore. Your brain's just gonna be tired. That's what happens, okay? Now, in the substances that we're talking about today, it's common to have both a CBD and a THC component, but what you need to understand is that it's typically in a ratio of at least 20-to-1. There's 20 times more CBD than there is THC in the products that are traditionally being used to address difficulties for children with an autism spectrum disorder. Now that may vary by state, that may vary by dispensary, that may vary by state laws and regulations, but as a general rule, when you look at the research, it's typically in set ratios, most commonly 20-to-1. The next part of this video, we're talking about evidence, data. Now listen, let me be clear. Every time somebody says they've got an article, I want to be very clear with you. That means a lot of different things. Just because you got an article doesn't mean it's a good article. hey, I got an article about something, I got an article about a man who married an egg and it was in the National Enquirer. Just because somebody has an article doesn't mean it's a good article. So if you're confused on how to tell the difference between articles, listen to this, okay? In the world of science, and trust me, I'm no scientist, I'm on YouTube. I mean, I guess I'm not really that big of a scientist, but in the world of medicine, we make decisions about what works, not just because somebody has an article. So please, when you bring an article to the clinic and you show it to your clinician, there's a few things you have to understand. We want to know what kind of article you're bringing, and also what kind of journal did it come from. Journals come in with impact factors, okay? So an example, you might think of a local publication like your newspaper or something that tells you information about what's happened, and that might have an impact factor of 50, let's say, which is really, 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 really high. I don't know, it might be the highest, okay? And then you've got your Uncle Joe who eats a bunch of peanuts and drinks Michelob Light and writes down the happenings of the town on the back of a napkin at the local pub. That information might have an impact factor of 1. Okay, so not all articles are the same, not all publications are the same, not all journals are the same. Some have an impact factor of 50 and you should listen to them. Things like Nature and The Lancet, you know, kind of big time things. And then there's others that have an impact factor of like 1. Okay, so you got another difference. But then also, most importantly, you have to know what kind of article it is. And science gives us a hierarchy to determine which articles you pay attention to. And what I want you to receive is that CBD and its proven justification in the use of children with an autism spectrum disorder has evidence to support it at the highest levels of the pyramid. At the highest level, we have systematic reviews, and we have meta-analyses. And think about these like, kind of like a summary of the very best of the best of the best articles, right? So somebody goes through all the stuff, okay? All the best baseball cards, and they pick out all the junk ones and all the ones that don't make sense and all the ones that didn't even, somebody lasted a year in the league or whatever, and then they take only the all-stars, right? All the all-stars, and then they select out only the all-stars of the all-stars, and then they put all those together and aggregate the data and publish that. That is what a systematic review is, okay? And a meta-analysis is similar in that it's like an analysis or review of all the very best systematic reviews. So think about this top tier is basically taking the cream of the crop and then deciding what's the very, very cream of the very, very top, distilling that down and finding the commonalities between them. And what I want you to understand is that the use of CBD in children with autism is represented in both systematic reviews and meta-analyses, and in the second tier from the top, which is randomized controlled trials. And that is trials where maybe a group of people who are matched together based on age and, you know, race and severity, and one group may be given a substance that has CBD, one group may be given a substance that does not have CBD, so like a placebo, and then they'll measure the effects between the groups based on agreed upon metrics and data that are measurable, okay? And then sometimes what will happen is they'll switch the groups, and the groups don't even know. So now you're getting the CBD, but now you're not. Now I'm gonna give it to this group, and this group's gonna get the placebo, and you're gonna get the CBD, and you're gonna get the placebo, and then we're gonna see if there's any difference there, okay? That is a great example of a randomized controlled trial, which is also represented in the literature as it relates to the validity and utility of CBD in autism spectrum disorders. Now let's talk about the benefits of CBD, right? You know the mechanism, you know the history, you understand that it's evidence-based, that it has evidence to support its use. So is it any good? Does it even matter? And the answer, of course, is yes. There's been several research articles that would demonstrate its use as it relates to decreasing or improving anger issues, anxiety, sleep-related difficulties, agitation, irritability, cognition, attention, social interactions. And most prominently, it's been shown to benefit restlessness. So think about the individuals that you know and love that struggle to be any one place for any one time. Move, constantly go, 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 go. Pick it up, put it down, pick it up, put it down, move, move, move. It's been shown to be beneficial in all of those areas at the very highest levels of research. Okay, lastly, let's talk about dosing. And please note that this is not a prescriptive video. I'm a doctor, I'm not your doctor, and I don't know that there are physicians, at least in the state of Iowa, who prescribe these things. We allow individuals to go and pursue the use of these products with the help of a dispensary after the individual has received medical clearance and the reason for the use of these products has been validated by a healthcare professional. I am not prescribing these things. I do not determine the dosages, but if you're going to be giving this if you're going to be using this strategy in a loved one, you deserve to know what the research shows in regards to the different dosing strategies. As I've alluded to earlier, the most common dosing strategy can be understood in ratios, and the ratios is always more CBD than THC. The most common ratio is 20:1. Now, that doesn't mean that it goes on forever, right? There's going to have to be some type of top end on both of these products. And that is, again, something that you work out with your regular provider or with your dispensary. But you have to understand that in general, 20:1 ratio is one of the most common dosing strategies that I've seen in the research. So I've seen the dosing strategy go up to 75 of CBD to 1 of THC in terms of ratios. So you can see there's a wide variety there. But one thing I want you to remember is that when the ratio is flipped, if there's more THC than there is CBD. There was one research article that flipped the ratios where there was 6 times as much THC as CBD, and what do you think happened there? Psychosis, agitation, irritation. Why? Go back and watch the earlier parts of this video where we talked about mechanism. Too much dopamine, brain doesn't like it, things don't go well. Okay? And then lastly, there's a milligrams per kilogram per day model that is also commonly cited in the literature. And that range goes anywhere from 3.8 up to 16 milligrams per kilogram per day of CBD with a ratio of THC that spans anywhere from 0.06 milligrams per kilogram per day all the way to 0.8 milligrams per kilogram per day. I've also seen maximum dosages of 600 milligrams of CBD to 40 milligrams of THC, just to give you a sense as to kind of what the ceiling is on some of these dosing strategies. Most of the research that's been done has been on individuals that are as young as 4 years of age and as old as 22 years of age, with the average age being 11. So know that there is data to help support its use in a wide variety of ages of patients. I sincerely hope this video has been helpful. If it's been useful to you and provided you with meaningful information, like and subscribe. I do think there's a lack of information in regards to the use of CBD, and I want to get this into the hands of as many people as possible. Again, please know that I'm a physician, but I'm not your physician. Talk to your regular doctor, make an educated choice with your family. Thank you for watching. There's more videos out there, and there's more to come.